The second wave of the COVID-19 pandemic has seen a serious surge in the active caseload across many states, and Kerala is no different. Kerala is one of the worst hit states in the country, hit of COVID-19. Despite having an active caseload, a huge sum, they still are faring better in compared to other states. One would ask, how is Kerala better handling this COVID-19 crisis? Well, so far we haven't heard of oxygen supply shortage in Kerala. The state government also says that they're carrying out uninterrupted vaccination drive in the state, and better more, they've now developed a pioneering electronic device that could curb and contain this airborne novel coronavirus. Kerala clearly has done something right. Has it learned lessons from 2020? Well, what was the situation back in 2020 in Kerala when the pandemic began? Situation was surely not the same in Kerala when the COVID-19 struck in Kerala. It was one of the first states that COVID-19 cases were reported. In fact, until 2019, Kerala entirely depended on neighbouring states of Karnataka and Tamil Nadu for oxygen supply. And then the onset of COVID-19 led to a turnaround. Kerala now needs less than 100 tons of medical oxygen in hospitals daily. It has a production capacity now of 204 tons of medical oxygen per day. So much so that it has been supplying medical oxygen to neighbouring Tamil Nadu and Karnataka now. Following an appeal from Delhi Chief Minister Arvind Kejriwal, Kerala has now said that it would supply medical oxygen to Delhi as well. So how did Kerala ensure that they have enough oxygen? Well, recognizing the need for oxygen in time was what they did. In fact, when COVID-19 cases rose in 2020 March, Kerala's COVID-19 task force did anticipate and flag off that there will be a sharp demand for medical oxygen in due course of time. It must, however, be noted that it was the Petroleum and Explosive Safety Organization, the PESO, that actively sent out letters to oxygen manufacturers in March last year to increase the production of this breathing gas. New plants for oxygen production were set up in the public and private sectors. Kerala now has 23 oxygen plants, most of which have come up only in the last 2 years. In fact, ever since the COVID-19 outbreak in India, reports suggest that Kerala has augmented its oxygen production capacity by a whopping 60%. Apart from ensuring sufficient oxygen supply, Kerala has also changed its approach towards treating COVID patients. They've kept a strict check on the number of COVID cases in the state and have treated those people with COVID-19 at a much early stage. The Kerala government has intensely worked with healthcare workers and grassroots level workers, that is the ASHA and the Panchayat level workers. They are making sure that anybody with the slightest of symptoms such as fever is tested for COVID-19 and if at all should be hospitalized. Early detection of COVID-19 is helping Kerala manage its patients quite well, and the need for oxygen has reduced due to early medical attention. Well, Kerala has seen a surge in COVID-19 cases due to the recently concluded assembly elections, but yet it seems like the state has managed its oxygen needs quite well. These are trying times and states are struggling, but it is time for states now to learn a lesson or two from Kerala.